Boa tarde a todos. Vamos recomeçar os nossos trabalhos com uma conferência pela doutora Linda Tannenbaum. A doutora Linda Tannenbaum é presidente da Open Medicine Foundation e tem dedicado... let me begin again. Founder and CEO, president of the Open Medicine Foundation. As president and CEO of Open Medicine Foundation, her efforts are dedicated to funding and promoting research into ME/CFS and related chronic complex diseases. Linda created OMF in 2012 with a vision of catalyzing large-scale research efforts to develop diagnostic tools, effective treatments, and ultimately prevention methods for these diseases. Linda, thank you very much for agreeing to talk to us. The floor is yours. Okay.
Good afternoon, and thank you for inviting me to speak today. Especially thank you to Joan Hoffman and her team with Alianza Millions Missing. I'm sorry that I'm not able to be with you in person today, and I had the pleasure of coming last year. But I'm grateful to be part of this and to have you all sharing your information with each other today. Joan asked me to give you an overview of the origins and vision of Open Medicine Foundation, OMF as we call it, and our collaborative model, as well as how we incorporate patient-led science into all that we do. So some of you have heard me talk before, and I apologize for repeating myself. But for those of you that don't know about us, the purpose of me talking with you today is to encourage and inspire researchers and clinicians to share openly and collaborate to accelerate our end goal, which is really getting people better and back to good health. So I'll get right to it. It's both an honor and a privilege to be with you to discuss the critical work that we're all doing to advance this research and to care for patients with these chronic complex diseases. These conditions that we all know affect millions worldwide, including, of course, here in Portugal. My philosophy has always been that together we can make a difference to bring hope and healing to all. And I want to thank the speakers for all that you're doing and for sharing the information that you're sharing today and tomorrow. It's really important. Like many of you and millions with similar stories, my own personal journey with ME/CFS began in 2006. A year that forever altered the course of our family's life. Our vibrant 16-year-old daughter, who was the picture of health, suddenly fell gravely ill. It was the first day of her 11th grade, and I just dropped her off at school at 8 a.m. in the morning. And she was full of excitement and promise, and within about just 20 minutes to 30 minutes, our world was shattered. We were called from the school nurse that something was wrong, and we ended up rushing our daughter to the emergency room, fearing that she was having a heart attack. Her first symptoms was heart pain. Overnight, our daughter was transformed from an active volleyball playing teenager into someone who could barely get out of bed. The simplest tasks like walking or sitting up became insurmountable challenges. My husband, Don, and I embarked on a desperate quest for answers, taking our daughter to 20 different doctors, 3 different neurologists, a cardiologist, rheumatologist, internal medicine, infectious disease doctor, oncologist, pain management, hematologist, gastroenterologist, and countless others, only to be met with confusion and uncertainty. No one knew what was wrong with her. And I emphasize this because all of these doctors, nobody knew what was wrong with her. I mean, from all of these symptoms, nobody could put it all together. Until about 5 months later, and thinking that she was dying of a misdiagnosed brain tumor, UCLA Rheumatology Pediatrics diagnosed our daughter with something called myalgic encephalomyelitis, but at that time was referred to and called chronic fatigue syndrome, now called ME/CFS or ME or CFS-ME, depending on where you're from. We were met with the sobering reality, though, that there were no available treatments or solutions for her condition. The only option at that time was pain management, which nothing worked for pain. Even today, however, it can take months or even years for people to get a diagnosis, if you're lucky enough to even get one. The same thing is happening with those who are suffering from long COVID. So many people are not believed and stigmatized and feel invisible and really disappear from life. Many times their own family and friends don't even believe them. This deeply personal experience became the catalyst for me creating Open Medicine Foundation. Once I found out that millions of people have this disease, millions of kids are out of school, millions of people are out of work and home, and not enough was being done about it at all, anywhere in the world at the time. Someone needed to do something to find a way to diagnose and treat these horrific diseases, and then train clinicians to recognize them, so people didn't have to go to 20 different doctors and then get no diagnosis that is going to lead to a treatment. Despite the urgent need, government-funded research, as you know, for ME/CFS is minimal worldwide, lagging far behind most, if not all, other diseases. Because of this, research is mostly funded by patients and loved ones themselves, donating to nonprofits like ours and others in this space. And this, of course, slows the progress tremendously. I'm going to share my slides. I have a few of them. Hopefully you can see them properly. In response to this urgent issue, we established OMF in 2012, and this is now our 13th year. And I thought it was important to give you our purpose, mission, and vision, so that way you can create something yourselves along the way, so that all of us can collaborate worldwide. Our purpose, as we set up, is to revolutionize the way we understand and treat chronic, complex, multi-system diseases that are really not looked at as a whole, with the initial focus for us with ME/CFS and long COVID, by illuminating their mechanisms, accelerating effective treatments, and empowering personalized care. Our mission is to drive and fund global collaborative research that unlocks the disease biology, delivers precise diagnostics, and advances treatments, giving every patient a pathway to care and hope. And our vision, all of our vision, is a world where ME/CFS and long COVID and those related diseases are understood, rapidly diagnosed, and effectively treated, so every patient can live fully. OMF is distinguished by an international collaboration. We have an international network, which is essential to accelerate transformative results. Our research directors include and mentor many young investigators on their research teams, with over 200 scientists and clinicians on their combined teams and collaborators. We built an expansive research network that spans 3 continents, connecting leading scientists from Uppsala, Sweden, Stanford and Harvard University, and the University of Melbourne in Australia, and Montreal in Canada. And we collaborate with many other research centers across Europe and Australia. We hope to do the same with Portugal as well. These partnerships work because they're built on trust and shared principles, scientific rigor, open collaboration, open communication, and an unwavering commitment to patients. The collaborative model includes several key elements. Samples collected can be shared to maximize the value of these precious patient samples from center to center. We may collect samples in Montreal and send them to Uppsala, send them to Australia, send them to Harvard or Stanford. On the same patient samples, we can learn so much. Knowledge gained from one center immediately benefits the studies of other centers, which in turn informs the researchers to either stay on course or change course completely. We have monthly meetings with our directors and an in-person meeting once a year. Regular international conferences like this one facilitate knowledge exchange and a culture of openness where researchers share both successes and we want to hear your failures, accelerating and learning for everyone. To date, we have supported over 67 different research projects and many publications through our centers, and have inspired and collaborated with many other researchers, setting a global model for others to emulate. We're just trying to accelerate research. This is why Joan asked me to speak with you today. This is why we're all here, to encourage open global collaboration. In addition to our focus on medical education, we have 3 research pillars that our research focuses on specifically: the clear disease model, accurate diagnosis, effective treatments. How can we translate to improving patients' lives? We and other organizations like Alianka, Millions Missing, shape research priorities by listening, truly listening to patients and their families. We hear their stories, understand their daily struggles, and translate their urgent needs into research questions that we discuss and pursue with scientists. This patient-driven approach ensures that research efforts translate to improve patients' outcomes. We have people with lived experience on our boards and on our staff. We've learned that the people with lived experience must be partners, not just subjects in research. They're essential to all aspects of study design, from priorities, criteria, outcome measures, subsets to consider, and the protocols themselves. The patient community has been instrumental in shaping our research agenda. People with lived experience teach us which symptoms matter most, which outcome measures truly reflect their experience, and which research questions will have the greatest impact on their daily lives. We still have a lot of improvement needed in this area ourselves, and we want to increase the engagement from those who know the most about these diseases, those with the lived experience. We published a paper that Dr. Wenzhong Zhao spoke of during the last conference here, from patients reporting which treatments worked for them, what symptoms they helped, and which ones harmed them. After almost 2 years of analysis, we were able to share this with the public, and also we took this information and altered our own clinical trial outcome measures by what we learned from those experiencing these diseases. Dr. Martha Ecke, a person who sadly is living with these diseases, created this incredibly detailed survey to gather this information from others like herself that are living with ME/CFS and long COVID to help others help themselves. One challenge that most researchers have is finding enough participants. Therefore, in May of 2023, we launched OMF's Study Me Participant Registry, a groundbreaking initiative designed to bring those interested in participating in research to those researchers looking for participants, therefore accelerating recruitment and in turn accelerates research. OMF Registry empowers individuals with ME/CFS and long COVID to actively participate in research. With over 14,300 participants already, growing rapidly from over 61 countries, OMF Study Me has already facilitated recruitment for over 20 research studies at top universities worldwide. It's free to patients and it's free to researchers. The purpose is to simply accelerate research. Last week, we heard that we had gone out with a request via Study Me, and the researchers received 500 signups within 3 days of posting their survey. We're here to help. We can share this more in Portugal and invite patients to sign up and researchers, and then help recruiting locally here. We have a large 1,000-sample biomarker discovery project just about to launch in Sweden, with samples from patients in Sweden and 5 clinicians across the US via the National Institute of Health biobanks, with testing done in Canada, Finland, and Uppsala. We also have a project that we're calling, and it's called BioQuest, large-scale, geographically diverse, disease-controlled biomarker signature discovery project. We're looking for a biomarker signature. We've acquired about 1,000 plasma samples already, 400 ME/CFS, 200 healthy, and 200 disease controls, including long COVID. The testing will be involved with multiomics, cytokines, immunoassays, and expected to begin by the end of the year. We're very excited about this project and where it may lead to. The other big project that we're doing is the Life Improvement Trial, which we call the LIFT, and it's a randomized double placebo-controlled clinical trial on low-dose naltrexone, LDN, and pyridostigmine methanol. And we have about 160 participants that we are anticipating being as part of this. About a third of these total participants have either completed the trial or are in progress at this time. Perhaps most importantly, research is providing hope. For too long, patients with these conditions have been told that nothing can be done. Findings are challenging and showing us the narrative that these are real biological diseases with identifiable mechanisms that can be targeted with appropriate treatments and possibly reverse this disease altogether and bring people back to good health. Portugal has tremendous potential to contribute to and benefit from global research efforts in this field. Your country has several key advantages: a strong healthcare system with excellent medical professionals, world-class research institutions with infrastructure to conduct cutting-edge studies, and a strategic location that facilitates collaboration with both European and international partners. And most importantly, a patient population that would benefit enormously from advances in this field. Portuguese researchers could contribute unique perspectives to global studies. Your researchers' expertise in areas like immunology and neurology and infectious diseases could provide crucial insights into disease mechanisms. Collaborative studies need diverse patient populations to ensure that findings apply broadly. Portuguese patients could contribute to biobanks, participate in clinical trials, and help validate research findings across different populations. Portugal could also serve as a model for how smaller countries can punch above their weight in global research efforts. By focusing on specific areas of your expertise, building strategic partnerships, and leveraging existing strengths, Portuguese researchers could make a disproportionately large contribution to this field. The challenges we face are significant, so is our potential for impact. These diseases affect millions of people worldwide. We all know that. But they also represent an opportunity to demonstrate how collaborative, patient-centered research can really transform lives. Success will require continued investment in research infrastructure, support for international collaboration, and most importantly, a commitment to keeping patient needs at the center of everything we do. It'll require countries like Portugal to see themselves not as peripheral players, but as essential contributors to the global effort. The urgency is real, but so is our determination. With continued collaboration, sustained investment, and unwavering focus on patient needs, we will transform the landscape of care for these complex diseases. Looking forward to where we stood in 2012, and now with a perspective of 2025 in the next 5 years, OMF's roadmap is clear. We're moving from pure discovery science towards translating research findings into diagnostics and targeted treatments. We've been doing this for 13 years, it's time. The integration of multi-omics data across our global network is revealing patterns that point towards personalized treatment approaches. Over the next 5 years, we envision a world where ME/CFS and long COVID patients can receive objective diagnostic tests, where treatment decisions are guided by biological subtyping rather than trial and error, and where targeted therapies are based on mechanistic understanding. This isn't wishful thinking. It's a realistic projection based on the trajectory of the research project progress and the strength of everyone's collaborative effort worldwide. Open Medicine Foundation exists and thrives because patients around the world continue to advocate, participate in research, and support scientific progress. It's succeeding because scientists are willing to collaborate openly, like yourselves, share data freely, and mentor the next generation. And together, the world at large will ultimately achieve this goal of finding effective treatments and ultimately cures for ME/CFS and long COVID and these related conditions. Because we recognize that patient-led science isn't just a philosophy, it's the fastest way to break through discoveries. Thank you all for being part of this journey, and together we can make a difference. Thank you.